for joining, Dr. MacDavid. How are you?
Absolutely. Good. How are you guys?
Doing good, doing good. How's your weekend going?
It's good. We just had interviews for plastic surgery today. So I got to the hospital around like 7:30 and it was just back-to-back interviews all day until like 1:30. Came home. I worked on my home office, which is this, and now I'm ready for you guys.
Wow, that's awesome. Very exciting. Thank you.
Yeah, absolutely. This is a cool club that you guys have going.
Thank you. Yeah, I'm really happy. We've ended up expanding this club to so far like 7 or 8 different CCSD schools. So I'm really
Okay.
happy that we can help a lot of students who don't really know too much but want to learn more, kind of give them a gateway into what it's like in healthcare, how to get there and stuff.
Yeah, absolutely. I was quite impressed with the biography that you made of me. It's very accurate.
Thank you. I appreciate it. We also try to do some research and stuff, so thank you.
Yeah, it's amazing what you could find online with people. Like just by doing a couple searches, you could find so much stuff out.
Literally, at-home
Pictures and
detective.
everything. Yeah. So,
Cool. Thank you so much. So yeah, we can go ahead and get started.
okay.
Let me pull up my light. Okay. Hello, my name is Brianna Shaw, and I'm the president of GVHS Medical Society. Please join me in extending a warm welcome to Dr. Joshua MacDavid, a highly skilled plastic and reconstructive surgeon and an assistant professor at the Kurt Krikorian School of Medicine at UNLV's Department of Plastic Surgery. Born and raised in Las Vegas, Dr. MacDavid's journey in medicine began at the University of Nevada, Reno School of Medicine, where he earned his Doctor of Medicine degree. He then completed a rigorous general surgery residency at the Kurt Krikorian School of Medicine at UNLV, followed by a fellowship in plastic and reconstructive surgery at the University of Louisville School of Medicine. Dr. MacDavid specializes in abdominal wall reconstruction, microsurgery, and complex reconstructive procedures following oncologic surgery and trauma. His commitment to advancing surgical care extends beyond the operating room, with research interests in surgical infectious disease and the role of nutrition in optimizing surgical outcomes. His contributions to the field are widely recognized with multiple publications in esteemed journals, such as the Journal of Reconstructive Microsurgery and the Journal of Cellular Physiology. He has also authored several textbook chapters, further demonstrating his dedication to medical education. Throughout his career, Dr. MacDavid has received numerous accolades, including the Clinical Excellence Award, the Program Directors Award, and the Outstanding Statewide Resident Educator Honor. He has also been recognized with the prestigious Gold Humanism in Medicine Award, reflecting his compassionate approach to patient care. Dr. MacDavid believes that practicing medicine is a privilege and follows a deeply personal philosophy, treating each patient as he would his own family, and never asking a patient to do something that he wouldn't do himself. Dr. MacDavid, we are honored to have you share your valuable insights in a fireside chat with the GVHS Medical Society today.
That was a great introduction. Thank you.
Of course, no problem. So we can go and get started with our first question. This
Okay.
question is about a day in your life. Can you walk us through a typical day as a plastic and reconstructive surgeon? What does your schedule look like, and how do you balance clinical work, research, and teaching?
All right. So the typical day for me starts pretty early. I like to, I really like fitness and I like working out. So I got to do that. All right. And it's very difficult to do that in the afternoon or at the end of the day. So I always have to start with the morning workout. So I usually get up around 4:45 and I start my workout at right around 5 or 5:10. And because I love fitness so much, I built a gym in my garage. So I have everything that I need to do a great workout right there. So I could get out of bed, go downstairs, and get into the garage and start working out. So I'll do that for about an hour, hour, 10 minutes, shower, and I head into the hospital. Getting to the hospital around 6:45. And my surgeries start typically at 7:30. So I'll have about 45 minutes to get the patient prepared to go to the operating room. And then just depending on what I have scheduled for that day, I might do a couple small surgeries, maybe each like, 30 or 45 minutes a piece. And I can get 3 or 4 of those done. Or on some bigger days where I'm doing some bigger reconstructions, I might do a single 12-hour long surgery or a 16-hour long surgery. And I'll start that at 7:30 and finish in the evening. So it really just depends on what type of consults I have and what type of patients need care and what operations they need. So my day can be very short, as actual work time as low as about 3 or 4 hours in a day, or it could be as long as like 16, 18 hours, and even longer, depending on if I'm on call that night. But the typical day will be just like that. I'll get up, go to the gym, go to the hospital, do my surgeries, and then after I'm done with my surgeries, I'll usually have to see people in the hospital. So I'll go around to my hospital and all the patients who are in the hospital after surgery. I'll see them, check on them, see what their wounds look like, check their labs, write some notes in the computer, and then go home. And I'm typically home by about 5 p.m. So it's about a 10 or 11 hour day for me, and that would be typical. Some of my colleagues' days are a little bit shorter than that. They might do 9 or 10 hour days, but it's tough to get just an 8 hour day. And I don't think that would be enough for at least being a surgeon, just with all the stuff that there is to do. So that's my clinical days when I'm at the hospital. And I also have an actual clinic, which I do 1.5 days per week. So on Fridays is my clinic day where I see people in my clinic, and that will be a little bit better timing. So my clinic starts around 8 o'clock in the morning. I'll see patients until about 11:30. So about 2.5 hours, 3 hours. I'll take a long lunch of an hour and a half because they mandate it. Because, we have other workers who are in the clinic who have to take lunch too. So I'll get a nice little luncheon, and then I work from 1 to about 3:30. And then I'll go home, usually an early day on Friday. I'll be out of there by about 4 o'clock. So about an 8 hour day, which is easier. And then 1 out of every 4 weeks, I will take a weekend on call, which means that I could be doing a lot of emergency surgeries on the weekends or nothing at all, or maybe one surgery I'll have to go in for. So it's a lot nicer of a life. Now, the second part of the question is, how do I balance clinical work, research, and teaching? And, the residents are with me during the surgery, so it's fairly easy to teach them. I don't teach like really classroom lectures very often. I have done 2 so far since I've been here. But if I wanted to, it'd be pretty easy to work it into the schedule. I would just pencil it in for a certain time, pencil the meeting in, and then tell my scheduling people that, hey, I can't do surgery from this time to this time, and I'd be able to work that in. And then research, I work on it at night and on the weekends. Like I'll be doing some research tomorrow. So I just have to give up a little bit of extra of my ancillary time to research in order to get those projects done.
Wow, I think it's really inspiring how you manage to juggle so many things into your days and how you seem to have a good understanding of it. You have a nice routine going. I think that's really inspiring, and definitely time management, especially if you want to go into the medical field, is so important to start mastering and getting down. And yeah, that's really cool that you managed to tie fitness into your day every day. I've started getting really into fitness, and I've also came to the conclusion that after school or afternoon fitness, going to the gym does not work with me. It makes me horrible with consistency. So now I've started waking up before my school day and kind of going to the gym and working out. So I think that is also really cool. And yeah, that's really awesome that you're able to juggle so many things and still have a good head on your shoulders with all of it. Very inspiring.
Yeah, thank you. Yes. Time management is absolutely key. And I think that's really what you learn when you go to college. I think that's where you start laying the foundations, and, some very, in high school, I guess some very motivated high schoolers start to get to that with, you guys balancing running this club and doing all the other things that happen. But college is when you really start to have to buckle down and honing what you do in a day and really start planning your days out appropriately, especially if you're going to do pre-med, because the courses are difficult. There's a lot of competition and there's a lot of extracurriculars you'll want to do. There's the pre-med clubs, there's also research then. So that's when you kind of really start to learn how you're going to start to balance your life. And it takes a long time, and I'm constantly refining how I can get more efficient looking at my life. So efficiency, you would be surprised at how much you guys can do. You guys can do anything. There's no limits to what you can do if you become efficient at your work.
Wow, that's awesome. Very inspiring. Thank you so much. Great answer.
Hello, my name is Aaliyah Preciado, and I'm the GVHS Medical Society Social Media Director, and my question is on overcoming challenges. Medicine is a demanding field. What were some of the biggest challenges you faced during medical school and residency? How did you overcome them, and what advice do you have for students who may face similar struggles?
This is a phenomenal question, and I'm very happy to answer this. It's a long-winded question. It's a long answer because there's a lot of challenges that I have faced and that you guys will face going into medicine. So I think I'll do it in chronological order. So I think the biggest challenge that I initially faced was people in my undergraduate telling me that I would not get into medical school. And there's a lot of pre-med advisors who are in colleges who will say things like, "Yo, your GPA is not good enough. You didn't do well enough in Chem 101 or Biology 203. You got to be in that class, that medical school is hyper competitive and that you'll never get in." And I had several advisors encourage me to not go into medicine. And they encouraged me to go into some easier fields like nutrition or physical therapy or even optometry. But I knew that wasn't my calling. And so the very first challenge that I overcame was the ability to not listen to other people who were trying to bring me down and trying to tell me what to do with my life. So I continued to press on despite not having the best GPA. I graduated college with a 3.3 GPA, which is significantly below what the average acceptance GPA is for medical schools, which is probably around about a 3.85 or a 3.9 these days. So I was significantly below the curve, and actually for the University of Nevada, I was in the bottom 10th percentile. So I knew, though, however, it was my calling, and I didn't want to give up, which is the first lesson I'll bring to you guys, is never give up on your dreams, ever, whatsoever. Even if it seems like you can't do it, I've never met a single person. I've advised hundreds of pre-med students, medical students, and friends. I've never known a single person who really wanted something that didn't get it, meaning I never knew somebody who was serious about going to medical school who wasn't able to get in. And I've known people with GPAs worse than mine. I know people who had applied multiple times, but if you have a will and you have the passion to do it, you can 100% do it and you will get in. So that was the first challenge that I overcame on my journey. I would say the second challenge would be realizing, because when you're very young and in high school and college, you guys probably don't think about death very often, or how people die or why people die. But in medical school, you get inundated with basically information of like how people die. And I would say the first 2 years of medical school is learning how people die and learning how much suffering there is. So the realization that you are mortal is actually quite scary, and it's a step that you have to overcome when you get into medical school, because you're going to be confronted with a lot of dying patients, and then it makes you question your own life and your own family. And it can be very dark because it's constantly like, here's this disease that you can get, here's this disease that you can get, here's how this feels, and here's how that feels. So it's actually pretty scary, and it could throw a lot of people off. So I would say the second biggest challenge that I had to overcome in the journey of becoming a doctor is just realizing that people die, which brings me to the third kind of biggest challenge that I faced in my medical career was learning that sometimes you're responsible for that death of the person. And that comes with all type of surgical training within fields that deal with life or death situations, like trauma. General surgery is like that way, neurosurgery is that way, but mainly general surgery. So I unfortunately, and even some of my colleagues in residency, unfortunately killed some people just with not having the adequate knowledge or training responsible for people's deaths. Obviously, an accident, not on purpose, but as a physician, you have to be able to recognize and face that you will do, unfortunately, terrible things to people from either a lack of knowledge or a lack of skill at some point in time during your training. And so overcoming that is very, very, very difficult. So then the question is, what advice do I have for students in those situations? So in the first situation, which was overcoming negative outside influences, I would just say never give up, and that you can do anything that you want to. And it's very a cliche thing to say, but it's a very true thing. You should never let anybody tell you that you can't do something, because you absolutely can. If there's a will, there's a way. I've seen it happen over and over again. For number two, which I talked about, facing your own mortality and learning about death. I don't have an exact advice because everybody processes that differently. For me, it required just a lot of introspection and self-reflection and a lot of alone time. Actually, I used to go for runs and really think about my life and what I'm here for. But for the third, realizing that you will do harm to people, I think having grace for yourself is the biggest thing that you can have, where you realize that you do your best for people, but at the end of the day, even though you are a doctor, you are not God, and you are not the person that decides life or death. And as long as you put your best foot forward and you always do what you think is the right thing and what you would want somebody to do to you or your family member, you'll always have a clear conscience.
Thank you so much. Like you said, I think it's really important to do what you want to do and never give up on your dreams and keep trying to do what you want to do. I know right now, like I'm trying to do so many things, so many clubs, and
Hmm.
people are telling me that it's gonna be hard to like take certain classes or do certain
Hmm.
clubs, but I never want to give up on that, and I keep
Yeah.
trying. I'm still in those clubs, and I think it's going
Yeah.
well.
Keep doing it. Never give up. There's a lot of people, people call them haters, but there's a lot of them, and you're gonna meet people who are gonna be in your friends group, and your friends might even tell you that type of stuff, especially in college. They may say, hey, why are you doing this? Why are you doing that? You shouldn't be doing this. Like, just come party with us. Just come out for the weekend. There's a lot of people that you really have to shut out for your dreams, but I promise you it's worth it. I promise putting the time in now will make your life easier later on. Learn efficiency, keep the strong work ethic, and it'll reward you.
Thank you so much.
Hmm.
Hi, I'm Basil. I'm the Secretary of Green Valley Medical Society, and my question is on research and innovation. You've done extensive research in surgical infectious disease and nutrition's role in surgical outcomes. Can you share some key findings that have influenced your approach to patient care?
Yeah, I would say a lot of the research I've done has been sort of in the realm of infectious disease uh, and some nutrition. Some of a lot of the nutrition stuff is based upon prealbumin and albumin. during surgery. It's 2 markers that we can check. And so I think the biggest thing that I've found with doing my research has been just the importance of nutrition in wound healing. And if you have patients that are really malnourished, they really will not heal a wound, no matter if otherwise you think that they can. And so that's been one of the bigger discoveries, and one of the bigger things that has influenced my practice is that I really push on appropriate nutrition. I think that obviously nutrition is medicine, can be medicine. If you are putting bad things into your body will not work like it should. A lot of in the hospital, there's a lot of, unfortunately, bad diets that they give patients. I don't necessarily agree with what the hospital does and their dietary recommendations. They give a lot of junk food like cake and rolls and like spaghetti and pizza and things like that, which, I get it. Those things are good and easy and cheap, but for somebody who's trying to heal a massive wound, they really need a lot of protein and a lot of lean, healthy protein, omega-3 fatty acids. And so I've really changed my stance on that with time. I used to think that it was just like, well, just have enough calories. But research is showing, and things that I've been finding, is that it really has to be good quality food. So that's probably like the biggest thing that I've seen from any of my research. And then obviously with infectious disease things, it's really like surgical infections are actually pretty different depending on where you're at, because there's a different, what we call, microbiome that people have in different locations. So people harbor different bacteria in their skin and from different places. Like a swab of someone's skin in Nevada would be different than somebody in Kentucky, just because it's a different climate, there's different humidity levels, there's different bacteria that are in the air. So the infections that you see could be different in Kentucky versus Nevada, or East Coast, West Coast, or Europe versus here. And so being able to analyze what type of infections your patients have will give you better outcomes, because it's not always standard, and where you practice in one time what might be completely different than somewhere else.
Thank you so much. That was really interesting. Me personally, I have been paying more attention to what I eat and eating
Hmm.
healthier and things that agree with me, and it really
Yes.
has changed my life. It really has benefited my health in so many ways. So the fact that it translates to when it healing during surgery and all of that, it just makes things seem so much more important when it comes to nutrition. So that was really interesting. Thank you so much.
Yeah, absolutely.
Hey, hello again. I'm doing the next question, and it's on advice for future doctors. What advice would you give to high school students interested in medicine, particularly in surgical fields? Are there any skills or habits we should develop now?
Awesome. Great question. So I think, some big advice, and it's stuff that I've been talking about really this whole chat time. So the good skills and habits. So it's just having good efficiency, having good work ethic, having good efficiency during your day, not wasting a lot of time on stuff that is not going to lead you to your goal. You want to ideally be at a point where everything that you do in your life is leading you towards that goal. So if your goal is to get into medical school, everything that you do should be a doctor, I should say, should be aligned with that. So first and foremost, you have to take care of yourself, because if you don't have a good body, a strong body, you won't have a strong mind. The mind and the body are one. They cross-talk and communicate with each other through very complex pathways that we're just now understanding. So if you don't have a healthy body, you won't be able to study hard, you won't be able to work long hours, and you won't be able to make it. So first and foremost, you got to take care of yourself. Good food, good eating, and good fitness. So that's number one. Number two, again, is going to be learning how to be efficient in everything that you do, not wasting a lot of time watching a lot of TVs or doing a lot of things. Like in college, there's a lot of distractions. There's tons of parties. There's tons of a lot of things going on, sports games, and it's okay to do that stuff sometimes, but primarily you should be focused as much as you can if you want to get the best experience and have the best chances at actually achieving your goal. So I would say that. And then skills or habits that you should develop. Now, I think that one of the biggest things, and I don't know how, I mean, you guys seem like you're pretty social and are very good interviewers, which is nice. But there's a lot of people that nowadays, because so much stuff is online and because of the COVID era, people were out of school. They weren't really interactive as much as they were, like, from older folks like my generation. So I think having very good social skills, and a lot of that is learned in college. So keep doing things like this. I think social media is actually pretty important these days. Being able to be a content creator and being able to talk to people and help people, I think that's very important. So anything that you do to improve your social skills. So I would say those are the biggest things. And then when you get to college, the biggest thing in college is to try to learn science as best you can and do the best that you can. And I got a lot of C's in college. I still made it into medical school. I gave it my best, though. I gave it my absolute best, and I don't regret any of the studying that I did. So work hard, study hard, try to get the best grades that you can. It doesn't matter what college you go to. I would go to the cheapest college you could. It doesn't make any difference whatsoever in your medical school applications. So if you go to Harvard or if you go to UNLV, it doesn't make a difference whatsoever. Medical schools don't even look at that. And there's a lot of people who I've trained with that went to a lot of colleges that I've never even heard of, that were like small, tiny colleges, and people who transferred in from community colleges, and they're my doctor colleagues. So it doesn't matter whatsoever. So those would be the biggest things I would tell you guys now.
Okay, thank you. I really think that it is important to have good, efficient work ethic to reach your goal. That's something I'm working on right now, trying to juggle everything that I'm doing and trying to align everything that I'm doing with my goal, which is, to eventually go to medical school. So that's why I also joined this club, to try to start heading towards that goal. And
Absolutely.
like you said, social skills are important. And this is the first time I'm doing something like this, like interviewing people. And I think that's something that I'm trying to work more on. So
yeah,
I think it is really important too. So I'm really trying harder.
absolutely. Yeah, and keep it up, and don't get discouraged. It takes a long time to master juggling multiple things, and it's a skill that you get good at. So the key is, going back to my whole thing, the theme of this fireside chat is to never give up. So always keep trying, get better. You will get there. Baby steps.
Yeah, I'll try. Thank you.
Hi, so I will be finishing off this fireside chat with our final question. This question is about patient care and compassion. I want to personally thank you for the incredible care that you provided to my brother during his surgery. Your expertise and bedside manner made such a difference in our family's experience. So how do you approach these patient interactions to ensure that your patient feels comfortable and cared for?
Yeah, so I would just say that I've tried to just obviously be authentic in everything that I do and make sure my life aligns inside the hospital and outside of the hospital, always is in alignment with my goals, with my purpose, and with my life. And I think that authenticity shines through me, and will shine through you if you're living life according to your core purpose. The next thing that I always think about, that I always taught, is I try to talk to people how I'd want them to talk to me. And that's been always a guiding principle, is treat other people how you would want to be treated. So don't offer somebody a procedure that you wouldn't want done on yourself. So you'll hear this sometimes too, like, don't offer a procedure to something that you wouldn't offer one of your family members. But I take it deeper and say, you know, don't offer someone a procedure you wouldn't do on yourself. And so I think that has really helped me, because it always assures that I would make the right decision, because I care for my body. In and of itself, I wouldn't want to do something that hurts me. I wouldn't want to talk to somebody. I wouldn't want somebody to talk to me in a derogatory manner either. So I think that's been a real guiding principle. And if you follow that, it's the golden rule: treat others how you want yourself to be treated. That applies exceptionally well to medicine. And that's what I do. And I try to think like, well, what would they want to know if they were in this situation? What kind of medicines would they need in this situation? What kind of medicines would I want? And that's how I've been able to have compassion.
Wow, I think that's awesome. And yes, I think that definitely makes a lot of sense. And yeah, even with me, as I've, gotten older in high school, I've definitely worked on being a very empathetic person, to where now it's like not something I really have to like tell myself or remind myself to do. It's like I'm kind of naturally empathetic. And I think that that's why don't do to one patient what you wouldn't want to do to yourself. I think that speaks very strongly to me, because that's kind of how I like to think too. You always want to put yourself in other people's shoes. You never really know what someone is really going through. You never know, like, their life story, their family, this and that. So it's always important to be empathetic. And I think that that quote is just very powerful to me. And I'm probably going to be using that a lot from now on.
Mhm. I'm glad.
Thank you. Yeah, so that wraps up our fireside chat. Dr. MacDavid, I can't thank you enough for this. I really think this is our best fireside chat, to be honest. I know that when we share this to our club next week, that they're all going to take in a lot of your information, because a lot of the words you say and the way you word it, I could tell how it's just going to like speak to high schoolers on a high school level, especially with the never give up and, your story about how you didn't get the best grades, but you were perseverant and you kept trying and trying, and it paid off. I know that a lot of this is going to speak to my club, and that's kind of what our club is also about, along with showing kids a doorway into healthcare. It's also that, Nevada does have a very bad healthcare workforce shortage. So that's the second half of our club, is like, how can we get these students, nurture them in healthcare to help kind of bridge that gap?
Yeah.
So I think this was a very beneficial fireside chat, and I really appreciate it. It was awesome.
Yeah, absolutely. Always, keep my number and my email handy, and let me know if you need any help. I can help guide you guys.
That sounds amazing. I definitely will. Thank you so much.
Absolutely.
Okay, see you.
All right.
Bye.
Take care.